My name is Chesta Patel, and along with me, Jhanvi, Vaishakhi, and John, we take part in the article and play a different role in this presentation. My article name is like Management of Myofascial Pain Upper Trapezius, the 3-group comparison study published, and this study is published in a Canadian Center of Science and Education in 2012. So what is myofascial trigger point? It is an hyper-irritable spot, usually within a tooth band of a skeletal muscle, which is painful. On a comparison, what is a myofascial trigger point? Myofascial trigger point is a hyper-irritable spot, usually within a taut band of a skeletal muscle, which is painful on a comparison and can give a rise to characteristic referred pain, motor dysfunction, and autonomic phenomena. Now, what is a laser? Laser is a non-invasive light source treatment that generates a single wavelength of light. It emits a no heat, light, sound, or a vibration. It is also called a photobiology or biostimulation. What is ultrasound? It is a non-invasive method which consists of piezoelectric crystals that convert the electric energy to a mechanical oscillation energy using the high frequency alternative current. Myofascial trigger points are among the most common yet poorly recognized that inadequately managed causes of myofascial pain seen in a medical practice with a point prevalence to 10 to 18% and a lifetime prevalence from a 30 to 50%. It causes a severe discomfort and inability to walk. Other than that, symptoms usually involve a muscle pain with a specific trigger point or a tender point. Pain is aggravated with activity or a stress. After that, addition to the local regional pain, untreated and the chronic causes might lead the symptoms like a depression, fatigue, behavioral disturbance. Cause for a myofascial pain are structural inadequacy, tight constructive clothing, alcohol toxicity, inflammatory disease, and a relative growth hormone deficiency. Various treatment modalities and techniques such as manual therapy, acupuncture, stress re-education, electrotherapy, biomechanics, and ergonomic training, nutritional counseling, and a wide range of pharmacological management. There are evidence to show the effect of a laser therapy in the management of a myofascial pain. However, the result appears to be a variable based on parameters used to treatment. The aims of our study is the pain relief produced by a laser, therapeutic ultrasound, and ischemic compression in a treatment of a myofascial trigger points. The effect of a laser, therapeutic ultrasound, and ischemic comparison on the lateral flexion of the neck, and the effect of a laser, therapeutic ultrasound, and ischemic comparison on the tenderness due to the myofascial trigger point. Materials and methods. Patient with the cervical and upper trapezius myofascial pain were recruiting from outpatient service, master skill physiotherapy, and a research center, Malaysia. In the patient selection, in this article, they select 50 participants fulfill the inclusion. From there, 45 accepted for the participating, and they divided it in a 3 group in a 15 numbers of them, and the first group is ultrasound, second is laser, and third is the ischemic compression. And at the end of the trial, all the participants, 45 participants, complete the trial. In article for a study design, this quantitative research analysis was designed as a 5-day trial, a multiple groups, pre-test, post-test design as considered. In outcome measures, pain was assessed using the visual analog scale, that is a VAS scale, provocative pain testing using a soft tissue tenderness grading scheme, and active lateral bending of the cervical spine using inch tape were done before first session and after 5 consecutive sessions of therapy. For measuring a VAS scale, origin of the scale is indicated as a no pain and a terminal end as a most severe pain. The patient was instructed to move the indicator to represent his or her pain pre-received at the achieved. At the back of the scale, 0 to 10 numerical with a distance of 1 cm between their mark and the linear elongate rating of the constant pain stimulation is a reproducible and a changes in the rating of likely to be a real change in opinion. For a treatment parameter, therapeutic ultrasound, ultrasound head size is a 1 cm, mode is continuous, intensity is a variable according to a pain threshold but within a 1.5 volts per centimeter square, range 0.1 to 1.5 volts per centimeter square, treatment timing 5 minutes, and patient positions high sitting with a backrest. In therapeutic laser, probe size is a point probe 1 cm diameter, wavelength is a 904 nanometer, mode is a pulse, dose as 74 millijoule per centimeter square, penetration depth is a 1 cm, treatment timing is a 30 seconds, and a patient position is a high sitting with a backrest. In ischemic comparisons, a manual digital pressure, treatment time is 5 minutes, a patient position is a supine line with a small pillow or a towel roll to support the neck, and the treatment technique is initially thumb or strongly the fingers was pressed directly to the trigger point to create a tolerable pain or a sustained pressure. Statistical analyses were expressed as a mean or plus or minus standard deviation to compare the difference between the groups. ANOVA was used and the chi-square test was used to calculate the difference between the outcome variable between the groups also, and along the study period. A significance level of a p-value less than a 0.05 was used for all the comparison, and for perform this analysis they used SPSS software. Results and the discussion: there were no dropout from the study, no difference existence between the groups in terms of age and gender, and which we think that a good point about this article. With a group analysis using ANOVA revealed a statistical significant difference among all the 3 groups between the pre-test and the post-test scores. There were insignificant difference between a pre-test and a post-test scores of a tenderness grading among the 3 groups. The main difference in the change of a score of the variables among the 3 groups were plotted as a graph which shows the group 2 has a higher tendency and a change between the start and the end of the trial. You can see that in this graph. Chi-square were used to compare the difference seen in the group 2 against the group 1 and the 3. It was found that there was a statistical significant difference between the change of a score in a group 2 when compared to the other 2 groups as shown in this table. The main issue in the treatment is to provide a pain relief on a trigger point. The current trial was designed as a 3-group comparative analysis to objectively record the effect of a therapeutic ultrasound, laser, and ischemic compression in the improving range of motion and reducing pain among the cause with MTP. The range restriction of a 20 to 40 years minimize the influence of a pain from a degenerative joint and a disc disease. In the evaluation of the data revealed that all 3 groups shown a significant decrease in the level of pain perception, overall pain intensity, and the extent to which the patient was suffering from a myofascial pain syndrome, together with an overall increase in a cervical lateral flexion range. In the literature that support the use of ultrasound, it was found that a pain relief was due to the assuming a thermal and a mechanical effect. This trial has shown evidence for a positive effect of a therapeutic ultrasound in improving the lateral flexion of a neck and a reduction of a pain perceiving level of pain. Yes. In our study, we observe a significant difference in the outcome measure between the start and the end of the trial for a laser. This graph illustrates a difference between the three groups to a superior amongst the group 2 patients. The more sustained improvement seen in the group 2 may be attributed to a therapeutical significant benefit of a laser's ability to stimulate a pain synthesis, soft tissue repair, and a subsequent tissue regeneration. An appropriate pressure was used to that treatments in this study, and in addition, all patients were treated by the same researchers, which added to a reduced bias due to a faulty research. Thus, it is evident that all three types of therapeutic modalities may have a similar but not identical mechanism of action to a neuromuscular level. Now, limitations. The first limitation of this study is they were not be able to explain why ultrasound and the ischemic compression technique did not elicit an outcome similar to a laser. Also, ultrasound and ischemic compression technique requires an additional training and experience for the treating a therapist. It requires a good communication and a concentration for both patient and a therapist. Whereas laser has an advantages over this factor, which makes laser as a handy tool in management. Our personal critique was a treatment. Laser treatment has shown a significant effect on a myofascial trigger point, but the time frame for the study was limited. Also, it helps to give a quick effect on a trigger point as compared to the other modalities, but we do not know if the effect for a longer period, since there was no follow-up in this study, and the effect can be subjective and has possibility of being biased. As for the result, they have used the Vaishakhi, which is a very subjective tool and depend on every individual patient. Also, they did not find any changes in the tenderness grading scales.